If you have been diagnosed with breast cancer and considered not having any treatment, you can be assured that you are not alone. There are people who decide against conventional treatment. So, to understand the outcomes that these patients might encounter, I did some research on what potentially could happen if women with breast cancer choose to decline standard therapy. The findings may surprise you. For those of us who believe that standard therapy does not help, as cancer will eventually recur and cause death, and that complementary medicine is better, may I encourage you to join me in this research journey and discover what the true evidence is. So in this video, I will be sharing, firstly, the percentage of women who decline conventional medical treatment. Next, I will show the statistics which will confirm that if you have considered this path, you are not alone. Then I will go through what it means to decline breast cancer treatment and allow the condition to take its natural course. Following that, I will show in real-life pictures what women can expect if the disease is allowed to progress. And finally, I will present my thoughts and suggestions. Let's begin. How many women with breast cancer decline treatment? Well, the exact number is difficult to determine, but in this study, these Canadian researchers found that of all women in the Northern Alberta Health Region who were diagnosed with breast cancer between 1980 and 2006, 185 patients refused standard therapy. This formed 1.2% of all patients. This is one of the very few studies which have evaluated women who declined standard medical therapy and followed the entire patient population to derive outcome data. As we see, of a total of 15,427 women diagnosed between 1980 and 2006, 185 refused standard treatment. So the question is, what happened to these women? How did they fare compared with the others who underwent primary standard therapy? These are survival curves. They are derived by following up women for a prolonged period of time, usually more than 5 years, and monitoring their status regularly. The y-axis represents the percentage of women still alive, while the x-axis represents the time which has elapsed after diagnosis. When two or more curves are drawn on the same chart, it gives us, at a glance, a comparison between two groups of patients. The researchers found that 5-year overall survival was 43.2% for those who refused standard treatment and 81.9% for those who received them. In other words, on average, less than half of the women who declined treatment would still be alive 5 years after diagnosis. This is in contrast to women who underwent treatment, of whom more than 80% were still alive and well 5 years after treatment. Allow me to summarize this part of the data. 81.9% of women who received conventional treatment were still alive 5 years after standard surgical and medical treatment. Of those who refused standard treatment, 43.2% were still alive after treatment. Looking at this data, we will see that it is true that treatment does not guarantee 100% cure. 18.1% of patients who underwent conventional treatment succumbed to their disease even with their best efforts. However, it is plain that the data shows that treatment gives a person the best chance of surviving breast cancer. What about complementary or alternative medicine? Of the women who chose not to have standard treatment, 50 had complementary and alternative medicine, while the reason for refusal was unclear for 37 patients. It was found that the 5-year overall survival was 57.4% for women who received complementary medicine and 26.3% for those whose treatment details were unknown. These data show that there may be some value in complementary medicine, but survival outcomes are still inferior to standard treatment. By now, it would not surprise you to discover that this team of researchers from Canada concluded that women who refused evidence-based treatment for breast cancer had significantly worse outcomes than women who received standard therapy. We have covered the first two intended topics on this subject. Before I move on to the third, I wish to prepare my viewers that the appearance of advanced breast cancer may be distressing to some. So if you feel you may be one of those who do not take well to unpleasant images, please skip the next chapter, which spans about 25 seconds. These are real-life pictures of patients of mine who declined treatment or who came to see me after living with their cancer for several months and even years. Cancer does not stay stagnant. It progresses and almost always affects the appearance of the breast before the patient finally succumbs to the disease. Don't let this happen to yourself or any of your loved ones. Please seek appropriate treatment. The question remains if there is anything to gain from declining standard evidence-based treatment. There may be cost savings, as modern cancer treatment may be financially challenging for some. However, one would have to weigh this against the cancer control and survival outcomes. There is much to lose without conventional treatment. Significantly lower chance of survival and cure, progress of disease which becomes difficult to control in its advanced stages, resulting in succumbing to the disease earlier than if therapy is administered. My thoughts are simple. If financially able and insured, may I appeal to all women to receive conventional evidence-based medicine. This entire channel is devoted to evidence-based surgical treatment of breast cancer. For those who wish to have more information, please check out the relevant videos. If a patient needs financial assistance, kindly locate the social services in your community to seek support for treatment. Receiving treatment is essential for a best chance at cure. Thank you for staying until the end of this video. If you have found the information useful, please like, share, comment, and subscribe. There are scores of other videos in this channel where I have presented the data and evidence which guides standard breast cancer surgical treatment. Please join me in those other videos too. Until we come together again, take care.